We're doing it again.
Day 3.
The third and final day at the Summit Conference 2025 at Sundance Mountain Resort. And we get to talk to a few more people today. I'm looking forward to it.
We just ate breakfast. Do I have anything in my teeth? I didn't even check.
It's okay. This is an audio. Don't worry about it.
Oh, okay, good.
You don't got to worry about that. No, you look good, though. Looking
right.
sharp today.
Thank you. Well, today we have Sarah Heath. And she's a great friend of ours and former employee. I assume that you've detached yourself now that you're full board into medicine, medical school at the University of Utah.
That's
Congratulations
correct.
again.
Thank
I know that
you.
was a big milestone for you. But kind of backing up a little bit, Sarah, you were part of our first wave of employees that we hired under this title, Patient Care Coordinator.
Yeah.
And maybe just in summary, a quick summary, kind of tell me what your initial experience was coming into Summit.
We were thrown into the deep end. It was a new program, and so they had a bunch of undergrad kids, and I think I shadowed you, Tyler.
Oh no.
For like 2 patients.
I got a bad rap in the beginning for my lack of patience.
No, I remember the first day we had just some patients who, were having a hard time. They really needed to be seen, and it was a little bit of a shock to my system because I didn't know how I was going to be able to communicate with patients the way that you do. And
literally just thrown into clinic. I
Yeah.
think you guys had minimal amount of training.
Yeah.
And we really needed you at that time because we were growing and we were trying to find ways to offset some of the workload that we were acquiring just as we were building the practice.
It was a whole new concept as well. It's not like there was a defined role and responsibility.
I guess listeners, you would identify it as a medical assistant, right? That was our idea, but there was maybe a softer title and more of a broad-based title to maybe, I guess it doesn't get broader than medical assistant.
And combined with scribe, though.
Yeah.
A medical assistant that sits in and scribes. Yeah.
But that exposure and that experience, did it have an impact on you?
Absolutely.
I mean, clearly it's helped in some way, maybe?
Yeah, it got me into med school.
I don't know about that.
I will say, I feel like learning from you guys, I learned really quickly to seek after feedback so that I could get better at it. And it was okay to make mistakes, but make mistakes once and then be ready
we only
to,
allow one mistake.
One mistake, fix
Alex
it.
does it.
One strike, you're out.
You're out.
Yeah. But I think it really got me ready for starting med school and the rest of my journey.
I think that's what I've seen mostly in the patient care coordinator kind of theme is that, we watch these individuals come in and kind of a deer in headlights. But then towards the end of their time at Summit, I think you see the growth. And I've had plenty of them asking me questions that I'm like, I never thought about that.
Pretty sharp kids. I don't know that I would survive at this stage if I were to try and compete for a spot in these programs in these schools.
Some bright
There's
kids.
some smart, well-prepared kids out there ready to study medicine.
Young adults.
What's been your experience so far? Tell us about med school.
Oh, well, the rumors are true. It's hard. They throw a lot of content at you. My undergrad degree was in nutritional biochemistry, and truly they did cover my degree in 2 lectures.
Yeah.
So
Yeah.
it's a lot, but it's also a lot of fun. I'm getting a lot of new experiences. We did our anatomy lab, we did our cadaver dissections, and a lot of growth. It's really exciting to be on this path.
And you're 6 weeks in?
I'm 6 weeks in.
Oh man, we won't say how many weeks altogether it's gonna be. We won't start that countdown.
A few more than
yet.
6, though.
Oh yeah.
How about this conference? So, knowing that you're one of the original employees with the company here, tell us about the growth of this conference that we're sitting at today.
Yeah, it's honestly so fun to see the way it's grown. It's so fun to see the energy. Every year, I think people bring a little bit more energy. The talks are amazing. I love the engagement that people have. People are really invested in asking questions. And I think it's a good place for me and anybody else who is thinking about their journey in medicine and here to learn. I learned a lot. I went to Dr. Pitt's demonstration yesterday.
Yes.
So cool. He's good at what he does, and it's fun to see that.
Dr. Pitts did a live rendering of was it a total knee?
It was a total knee.
A total knee replacement using the robot. And just amazing. He's amazing at his craft and his willingness to teach and educate people. In fact, one year we had, or at least at Summit, we had the cadaver.
Which one?
where Dr. Pinch.
Oh, that's right. Yeah, we did that at the hospital.
Yes.
I do remember
So, I
that.
mean, it just the educational aspect, and I think, not to keep touting Dr. Edwards, but I mean, just his vision of just this idea of bringing the collective together, the collective minds together, and just creating an atmosphere where we all can learn and engage. And it's been super impactful for me in my career, and it has evolved too, because I think I've thought about prior conferences, and the themes were a little different. This year it's 1% better, and I know, Sarah, you've been tied up in school and haven't been able to go to all of the talks up to this point, but yeah, what are your thoughts? So you've heard the theme throughout the year, though, the 1% better. What does that kind of mean to you?
You know, I think in our personal lives and in medicine, we can always be focused on that 1%. I saw the talk, we had an Olympian who spoke yesterday.
Yeah, Peter Vidmar.
Yeah, and that was a really cool talk. He talked about how practice makes permanent, not necessarily perfect.
Yep.
And thinking both, again, personal life and in medicine, how we can practice and we can do well for people when we focus on that 1%, and practice makes permanent, put in the time.
I think in your situation it's so applicable too, because if you think about where you're at now, but you had to start somewhere. Yeah. And it was just taking little steps.
It was shadowing you, Tyler.
Yeah, well, I was trying to tee you up for that one, but no, I think the idea though is that we're all trying to get better, and I think I don't think there's no stagnant field in medicine. You're either getting better or you're declining. Yeah. And so I think the idea here is that we continue to encourage each other to push ourselves to get that 1% each and every single day. I think it's going to make a huge difference. So.
As a med student, everybody's going to be asking you, what's the future look like? Where are you headed?
I'm only 6 weeks in. I don't know that I'm the person to ask.
Future neurosurgeon. Come on, she's going to join Summit.
Yeah.
No, I think I have been very impressed with the collaborative mindset at school. That was something I was so impressed about here at Summit and at these conferences, and I didn't know if I was going to get that in school. But there is a very collaborative, interdisciplinary focus, even in shadowing some of the physicians I've shadowed and talking the way they talk about students and their future careers. And I've been impressed with that. I am really excited to see that in medicine going forward.
What do you want to do? Where are you going to end up?
I'm biased. I worked at Summit. I think neurosurgery is really, really cool.
I agree.
You're biased too.
Not at all.
Could you imagine me being your first assist? Oh my gosh.
You gotta wait 2 decades for that.
I might be an old man. They may not allow me in the OR at that point.
You can't be shaking with the retractor.
Oh boy, that
doesn't help.
That's awesome. Sarah, thank you so much.
Yeah,
it's been great.
Some time to chat with us and give us some insights from your perspective. So.
Good luck on the rest of the journey.
Oh, thank you.
We're going to continue to see you though.
Yep,
All
you
right.
will.
Yeah, thanks.
Yeah.